So I've been doing massage in general for 24 years, and I've had lots of studies at various schools and different techniques. One of the things that drew my attention was lymphatic drainage. And the reason for that is because one time I had done a very deep massage for somebody, and they said that they were in worse pain than they were before I got started. So that got me very curious, and then I was very fortunate to have an instructor who said after you take the muscle apart and work it over to make it nice, and he taught us lymphatic drainage. What I have found, sometimes the skin can shrink around the lymph area, so that it's like here's a lymph node and then the skin just kind of tightens around that area. We'll stretch the skin out to allow for more space so there's less constriction. So that's what we'll do here. I always keep an eye out for things that don't feel right, and especially in the lymphatic areas. A lot of therapists won't go there because they're taught not to dig in there, which is correct. You don't want to put pressure in where the exposed nerve endings are, like lymph nodes are here in the armpit, and these are glands, so you don't want to dig hard because you'll bruise them and could damage the nerves and stuff. But I always palpate in there and see what's going on, because for lymph drainage, it's a very gentle modality, so you're not going to injure that. If I feel something different, in the case of Lisa, I've always felt like there was some congestion of lymph in there, and so I would work it and empty it out, and it would keep coming back.
When they took those implants out, I think, once it's like opening a can of worms. Once they opened me up and yanked those implants out, there was still free-form silicone in my chest cavity. And once they got in there and started digging that stuff out, it just let it out, and it was disrupted. So it's all in my system.
We kind of kept her going for these last 5 years, just keeping her, she's always tired and low on energy, and so the massages helped her to keep her health up. I believe there's other factors that affect health, because nutrition is just really one aspect of health. You need hydration. Most of us don't drink enough water, and that can be a cause of lymphatic congestion.
That just feels like it's doing something already. Like it just feels like really good, and that it's pushing on the congestion.
I always check my lymph, and if I feel it's tight, I will pull in the area to create space, and then I will squish the area. So I do my own lymphatic drainage. Ramona Moody's book on lymphatic drainage, which you could probably find on Amazon, it has a section for self-lymphatic drainage with lots of good pictures. Definitely it's a good research for people to learn a little bit on that section on self-lymphatic drainage and what you can do for yourself.